You know, I've been cooking pretty much my whole life. We grew up in a single parent home. I spent all my time with my mom in the kitchen. I cooked in high school. I had a job cooking through college. And all my family are foodies. When we have family gatherings, we joke because all we talk about is grocery shopping, what we're gonna eat, and what we're gonna buy tomorrow for the dinner tomorrow. And it's already filtered on to the next generation of kids. Cooking is kind of like surgery in that there's a technical part of it, right? But then you have to create afterwards. And your outcome is based on what you've learned, what you've experienced, and your passion for an excellent outcome. We all start with different starting points. Ingredients aren't the same all the time. Patients aren't the same all the time. And if you can mold them together to be an outstanding result, that is your goal. And if you care about what you're making, the passion that you have is at the same level as it would be with surgery. I think, like medicine, you have to always learn. You have to be critical of yourself to get better, to make something really special and present it to someone. And you're never gonna make that perfect meal, but you always try, and you try and try to be perfect. So that's incredibly rewarding, and we always are trying to get better at doing what we do. I was drawn to plastic surgery because of the positive impacts I could make in people's lives. It was just really interesting. Types of surgeries, the breadth of what you do, from the head to the toe you end up operating on. So it really felt like home to me. I've been in practice about 23 years. The specialty of plastic surgery has not undergone drastic changes since I started, but my experience has made me a much better surgeon, and so you have a better idea of what you can and can't achieve. As far as patients go, it's all about trust. You have to care for the patient. You have to care about your outcomes. I try to be honest and compassionate and have integrity. I try to educate my patients and get their expectations in line with what's achievable, and then try to exceed those expectations ideally. It seems like everybody has a thing that bothers them, right? And if it bothers them so much that they're always hiding it, or feel ashamed, or change their lifestyle because of it, you can make a huge impact to make them feel better about themselves. You have to deal with every patient differently. Every patient is built differently. Every patient may heal differently, and their care could be different post-operatively. So that's the art of doing what we do. But the most important part is that you have the opportunity going to see a patient and they have a huge smile on their face, and they thank you, and they tell you that it really changed how they feel about themselves, and that makes your whole day. That is fulfilling to me. Edina Plastic Surgery has been around for a long time, and I am so happy that I work there. The patients should know that they're going to get outstanding level of care, both by the physicians and by the staff. So if you're interested in getting information, please give us a call.